the Stronger After Stroke podcast. I'm your host, Rosa Hart, the stroke nurse navigator for Norton Healthcare in Louisville, Kentucky. I'm with a very special friend of mine today, Flannery O'Neil, and she's here to tell us her story of having a stroke at the age of 34. Thank you so much for being with me today, Flannery.
Thanks so much for having me here.
I'm so glad. I wanted to start off with asking what symptoms you experienced when you had a stroke.
Sure. So I actually had a trans-ischemic attack and I had a stroke. And a trans-ischemic attack, or a TIA, is a mini stroke is what a lot of people call it. So I had my TIA about a week before I had my full stroke. And for both my TIA and my stroke, I experienced a sudden loss of my ability to speak. My face, I had facial droop, and I lost the ability to use my right arm and hand.
So that was a lot happening all at once.
Yes.
And when it happened the first time and the symptoms went away immediately, like how long did that last?
That lasted probably 20 to 30 minutes.
Okay. So did you make it to the hospital at that point, or is that something that just happened at home?
I was actually at a doctor's office, and I was just leaving a doctor's appointment. So I was in the parking lot when I realized something pretty serious was happening. So I was able to get back to the doctor's office. But by the time they kind of did all of the normal neuro checks on me, I was starting to recover. And so they let me go home. And now, knowing what I know now, that is not ideal. And so, you know, if I could turn back time, I would have gone to the hospital, of course, and ideally would have been able to prevent my actual stroke from happening. But unfortunately, that's not what happened. So then about a week later, I had my stroke and experienced all of the same symptoms, except when my stroke occurred, I got this really loud ringing in my ears, like louder than I'd ever heard. And then I just was not able to say anything at all, and was mute, along with facial droop and my hand or my arm going completely limp.
And so did you get any treatment for that? Was it in time to get treated?
Yes, fortunately. So I was at work, and I work in public health, and at the time was working at a health department and I was with my boss, who is a nurse. So you couldn't have had a better place to have a stroke, because we were very close to the hospital. She recognized immediately that I needed help and called 911. The EMS was there very quickly. So I was fortunately able to get to the hospital quickly. There was a little bit of confusion as to how severe my stroke was. Even though I was not really verbal, they thought that I might be improving. And so it took a little while before they decided that I should have the TPA to bust up my clot.
Mm-hmm. But you got it.
But I got it.
All
yes.
right.
And I was in a small town, not in Kentucky, when it happened. And so I got to ride on a plane and go up to the nearest comprehensive stroke center, which was in Denver. And so I was in Denver for a couple of days. And not long after landing in Denver, so probably about an hour or so after I got the medication, I started to be able to speak. Very little bits, but I was able to speak in a way that right after the stroke, I hadn't been able to.
Do you remember what your first word was?
So it was, I think it was my name. It was supposed to be my name, but it was my boss's name, because she was with me. And so I think I saw her and said her name instead of mine, but quickly was able to say my name and, short words and sentences. But it was pretty clear at that point that I had a speech issues after my stroke, and that was what was going to be my main disability after stroke.
So did the facial droop and the arm weakness resolve pretty quickly then?
Yes.
Okay.
That actually, I know the arm resolved before I got the TPA.
Oh, okay. So that was part of their decision-making process as to whether or not you really needed it. Yeah.
Yes.
But aphasia, which is the language difficulty you were talking about, is one of the biggest indicators for having a good outcome after a stroke, because communication is so necessary for getting better and coordinating and being able to be compliant with care and understanding what will help you not have another stroke, and then also communicating to the people around you what you need. So I'm so thankful that you were able to regain your speech over time. Right now, you're speaking so fluently that I would never assume that you had a stroke, let alone spent any extended period of time as an adult not able to talk. It's really remarkable. So could you talk about any differences that you experience with numbers as well as words?
Sure. So I can very vividly remember, just the fear and just being so scared and not being able to communicate that, in the way that we normally would be able to express our feelings after such a traumatic event. And I didn't want to go to sleep the night after my stroke because you're so worried that it might happen again. So I spent just laying in my bed hours just trying to read any word I could see around my room, or the little, the hospital menu, just to practice. And it, I felt like a little kid again, trying to sound out words. And to this day, that's something that is challenging for me, is sometimes spelling words or sounding things out, because it just, my brain has rewired, fortunately, but there are a few things that are not quite the same as what they were before. And so trying to find words sometimes, and the extent of the vocabulary I had is not what it used to be. But words came back okay. Numbers were really challenging. So trying to even look at a clock and understand what that meant, something that the day before I could tell time, look at the clock and understand that. And quickly that was all gone.
Wow.
So, and I would have the therapist come in and do an assessment on me, and they might ask you to remember a series of numbers, and I could not remember that series of numbers and say that to you forwards, but I could repeat the series of numbers backwards.
Oh.
So just really interesting things. And the speech therapist at the time likened it to like a tornado going, through your head. And it just takes time for the shelves to get put back and all of the books to get put back. And so, I feel pretty well recovered, but, it's certainly, my language is certainly different than it was before. And I had to do a lot of math problems, math work with spreadsheets with my speech therapist to get back to normal every day, and to be able to get back to what I needed to do in my career, and my work. And
yeah, that's something that you don't think of often. If you think of speech therapy, you don't usually think, I went over this spreadsheet with my speech therapist to teach me math. But there's a lot of cognitive therapy that they do for things like that. Could you describe some of the exercises that you did with them? And did you work with occupational therapy as well, or was it just speech therapy?
Primarily for my aphasia, it was speech therapy. And so we did lots of math problems and word problems of, if it's this time in LA, but you're taking a flight and you're going to Miami and you're landing at this time, calculating time changes. And
Wow.
that I remember that from my first session, just absolutely stumped, like, don't even know where to start. So it's like going back to elementary school and doing all of those fun work problems that we had. And it just was repetition, especially I think in every instance with stroke recovery, it's all about repetition. and just practicing, kind of reminding your body and your brain about the things that it used to know. And that was certainly the case for my speech and for my numbers. And I even did, as I was preparing to go back into the office, they were asking me, okay, what are the things that you need to be able to do that you're worried about? And spreadsheets was one of them. So I went into the office a couple of times with my therapist, or I brought my computer in there, and we literally worked on spreadsheets together and looked at spreadsheets and practiced to make sure that that was something that I was able to do competently so that I could go back to my job.
That is so great. And it's so wonderful you were able to go back to work. And I really want to dial back into what you were talking about when you were first laying in the bed that night and you were afraid, but you weren't able to describe how you were feeling, and where you feel that sounded pretty lonely.
Really lonely, even with really caring people around me. So originally my boss was with me, and then my family was there, my mom and my husband. And it just, in those first few days, hours, minutes, it just, what just happened? Is it going to happen again? Why did this happen? And what does this mean? Am I going to be able to talk again? Speaking was really my primary issue. I have some other sensation, like being able to feel things, like temperature of water, and but very minor compared to what it could be. So for me, speech was my primary challenge, and not knowing if it's going to get better. And especially early on in stroke recovery, the focus is getting you back to stable, not necessarily saying, well, this is what it's going to look like in 6 months from now. And human nature is to want to know, well, what's it going to look like next week and next month. And so a lot of my just thinking that time is I've never known anyone my age that has had a stroke. I thought stroke was an older adult issue. I mean, I've had stroke in my family, but I've never seen it in someone that was my age. And I didn't know anyone in my town that had a stroke. And so you just feel very isolated after that.
So what did you do when you were feeling isolated? Did you find other people like you?
I was hoping to, but again, I was in a small town, and the nearest support group, so I thought a support group might be a good place just to try to meet some other people, regardless of age. Mm-hmm. And the closest support group to me at the time was an hour away on a Saturday.
In person.
In person.
Because not everybody was doing virtual things.
Right. So really no Zoom support groups 6 years ago, or they were very few and far between. And it was a long way to go. Now, I was able to drive at the time, but it just was trying to find something that would fit in with my schedule. And that was not very convenient for me. So I was talking to my neurologist about this, and she was aware of someone who had her stroke right around the same time as me, and was also interested in a support group. And so we were able to get connected, and we started a support group for people in our community to gather, and we worked with the local hospital, got a space, and so that was really formative for me in just connecting with other survivors and realizing, while every stroke is different and everyone's recovery is different, our challenges are different, there are so many connections, similarities that we have. And it is really healing to be in a space with people who have experienced what you've been through. And you don't necessarily have to have all of the words that you need to just be with people who know exactly what that's like.
It probably makes it easier to find the words when you're with people who can wait until you find the words and know that you're thinking the thoughts.
Right.
You know what you want to say. You're just having trouble getting them out your mouth.
Right.
So if you're in a support group with other people who have that same experience, was a lot of it just that they knew to be patient and let you finish your sentence.
Yes, or you don't even have to talk. You can, other people are saying things and you have that acknowledgement of, oh, that's something that I've been going through. And that just helps you realize that you're not alone in this. It's a big, wonderful community, the stroke community. We hate having new members join us. We don't want any new members. But when you get here,
new stroke.
yes. But know that it's a warm and welcoming community, and that's, I think, what I've been trying to advocate for, and just let other survivors and their loved ones know about and get connected to is that community and that support, and that comes in so many different forms.
Yeah, I really appreciate you visiting our stroke support group that we have here in person and virtually. And I think you lead one, in at least one, or do you lead more than one?
I do. I do lead one, and I am a guest moderator for a support group specifically for people with aphasia called Virtual Connections. And that's an all online community with sessions every day, multiple sessions that people with aphasia and their loved ones, their care partners, their caregivers can sign up for. So I lead sessions there occasionally, and then I co-lead a young stroke support group with a friend of mine who's a stroke survivor and also a stroke care coordinator, or not care coordinator, a stroke coordinator in a hospital in Colorado. So that one is called the Young and Young at Heart Stroke Support Group. And we have folks from all across the country joining us on Zoom once a month.
That virtual connection just opens a lot of doors.
It is. So the Young Survivor Group was something that my co-facilitator and we had actually envisioned that to be an in-person group, and then COVID happened, and so we pivoted a little bit and started it on Zoom and started to get people from all over the country, and decided that it's best to leave it as a virtual group so that more people can connect.
Yeah. And then you've also become a member and a leader of another organization for stroke support as well. Do you want to tell us a bit about that?
Yeah. So as part of my recovery, I really I knew that I could make an impact on the stroke system of care. I had been working in public health. I have a public health degree. And so I really wanted to focus some time and energy on what can I do to make this experience and the system work better for us survivors, because there were many hiccups in my journey, and I know that I'm not alone in that. So for several years, I worked with the American Heart Association, working directly with hospitals, providing treatment so that, my experience of being in a doctor's office and not getting referred to the ER when I had my mini stroke, the time that it took to get my medication, that there were communities working on that and wanting to use my story to help encourage people. But I became aware of this incredible organization and couple called Stroke Onward that was specifically focused on the emotional recovery from stroke. A lot of times we see information about depression, anxiety, some of those diagnosable conditions after stroke, but we don't really talk about the trauma, the kind of the grieving. You've lost kind of your sense of self, your identity, and so to have that really cared for as part of your recovery so that you can have a recovery that looks at all of you and not just the disabilities that you see after stroke, but your mental health too. So this organization, Stroke Onward, was founded by a husband and wife who also were touched by stroke and recognized that there is a lot that is needed in our country and across the world to support people who have strokes better. So they've written a book called Identity Theft, and we are doing work to change the healthcare system, to bring awareness to this issue, and see if we can't make the healthcare system better meet the needs of us survivors.
Yeah. And have been using your discussion guide in our stroke support group as a curriculum so that we have that topic discussion with questions that are especially written for people with aphasia so that they're not too complicated and things like that. You guys have written some really great summaries that have made it accessible. And so I really love how you've taken your experience and just gone at making it better for other people and really channeled your energy into that. So thank you for all the work that you have done that I have already seen you do to encourage other people and improve outcomes through raising awareness. So if you are interested in learning more about that book that she was talking about, Identity Theft, you can look on strokeonward.org. The website you were talking about for the aphasia support groups, what was that?
That is, it's an organization called Lingraphica, and the specific program is called Virtual Connections.
So how does someone find it? Did they go to Virtual Connections?
Yes, Google Virtual Connections.
Okay.
It's not virtualconnections.org. So I believe that it's aphasia.org, but
Okay. I do have aphasia.org on my notes.
Okay.
So we'll start with aphasia.org and then also Stroke Onward. And then we'll also have a link in the show notes to where you can join in on our virtual support group as well. So there are lots of ways you can get connected. So if you want to go to an in-person support group, you can use the website stroke.org to type in your zip code and find the nearest one to you. But if there's not one that's close enough, those virtual support groups are a great option. And it doesn't have to be ours, but if you want to meet us in a support group, you can.
Yes. I just reach out for support, and that's in your local community. That's coming to one of the groups that Rosa and I talked about. But it's so important to know that you're not alone, because it is really easy to feel isolated, whether you have aphasia or not after your stroke. So just know that there are people out waiting to help you in your recovery journey.
That's great. Thank you for listening to the Stronger After Stroke podcast. We will see you in the next episode.